Great. Iris, let me know if you need to share anything else from Technica, or otherwise I'll just dive in. Great. All right, everyone. Thanks for joining us. We are excited to be here with you and kicking off the Technica Lightning Talks. And during this time, we're going to be sharing a couple examples of the work that Abt Associates is doing on the digital front. And we hope that this gives you a taste of some of the real world global health challenges that we're tackling with digital solutions. And that's also a subtle plug for the Global Health Hack. And during these lightning talks, we hope that you'll ask some questions in the chat, and I'll keep an eye out for those, and we'll also have time for Q&A at the end. And to get started, next slide, please. We will get started with intros. I'm joined by my colleagues, Emily Mangoni and Gabriel Krishak. And Emily, over to you to kick off the intros.
Great, thank you. So I'm excited to be here. I wanted to just give you a little bit of context about how I came to be working in digital solutions in development. I got my undergrad degree in international relations and French, and my master's in global health, and then my PhD I'm working on in health policy, so very much on the health and development side of things. But while I was working on my PhD, I had the opportunity to start applying digital solutions in development. So we're using mobile messaging and SMS to communicate and do behavior change with sex workers in Kenya. And that sort of led to work at Abt Associates as a digital health advisor, where I get to work across a whole, really globally, a whole host of countries. And my role at Abt is really to help our global projects and activities think about how to use digital technologies to enable and enhance their health impact. So that is really, my job really entails a lot of product management, product design, project management. I work with a lot of developers. Caveat is I don't do development myself. I'm not a computer scientist or programmer, but I really get my hands dirty with all the great thinking behind the development of these kinds of digital solutions. And it's really exciting because in one country, maybe I'll be developing a mobile application, and another it'll be sort of a social franchise ecosystem, and using a lot of digital technologies. So I'm excited to talk about some of the activities that I do today, but that's a little bit of how I came to be at Abt Associates as the digital health advisor.
Great. Over to you, Gabriel.
Great. Thank you very much. Well, hi, everyone, and thank you for coming to our session. We saw on the calendar that there are a few sort of competing, sort of similar sessions. So hopefully you can pop back and forth between some of the interesting ones. They sound really interesting. And so, yeah, my name is Gabriel Krishak, and similar to Emily and Sarah for that matter, kind of have taken a little bit of a winding road into what I do now and in our work for Abt Associates. But really, I think the thing that has us all sort of in common is just working at this intersection of using technology, using digital tools for that sort of social impact. So really explicitly trying to find something out in the world, whether it's in global health or education or environmental policy and regulation, just finding an area where we can actually take the technological tools that are out there and really applying them to something very explicitly that will have a social good component. And so very lucky to have those roles. Just my own background a little bit. Now I do focus a little bit more on the sort of digital side of things and a little bit more on the software development and the data science roles. And so I focus primarily as a data scientist in my role. I work we have a division that's devoted entirely to data science and enabling technologies within the organization to be able to help support some of this work around global health and education and others. But I didn't start out that way. I was similar to Emily. I was not a computer science undergrad. I was, when I was going through undergrad, and in that time, it was, I focused a lot more on sort of the liberal arts programs and wasn't quite as keenly interested. And it was only sort of later in life a little bit that I became a little bit more interested in that intersection and really sort of saying, oh, I can take some of these, web development skills that I was using in college, just doing really bad HTML sort of CSS websites, and then being able to say, oh, this could be really interesting in this new sort of space at this intersection. And so, I worked for a little while as a user experience designer, and then well, I went back to school and got a degree in information systems, and sort of did a little bit more on the human computer interaction side of things, worked as a user experience designer, and now in my current role is a little bit more broadly sort of applicable to some of these roles, but yeah, just really trying to think about how we can sort of use these tools to a lot of these different areas. So very excited to talk with you, to learn about all the things that you're doing. And if you have any questions about, oh, how does this skill set make sense? Like, what do the organizations look like? I'm in the Washington, D.C. area, so I know a lot of the organizations around here. So we'd be happy to chat either here or in the Slack channels as well. So thanks.
Awesome. Thanks, Gabriel and Emily. And yeah, I work with Gabriel on Appt's data sciences, surveys, and enabling tech team. And I'll actually be your moderator today. And like Gabriel, I'm also in the DC area. So, and we're really happy just to sound out some of your questions, and especially just as you're exploring some of these channels. My background is in similar to Emily and Gabriel. It's not necessarily in like hard development. My background's actually in public health program management. And while I'm not a developer, I'm really passionate about how that intersectionality that Gabriel was talking about, and using digital tools to make it easier for our country-based teams to do their jobs and implement more impactful public health programs. A little bit about my background. Similarly, it was a little bit of a windy road. My master's is in international development with a focus on public health, and I was based in Malawi, El Salvador, and Argentina for about 9 years, working on maternal and child health programs, family planning, and HIV prevention programs. And I actually stepped into this digital path because I utterly needed better ways to collect and analyze data on our family planning network. And also donor funding in Latin America for health was decreasing. So we needed to transition to more digital platforms for our outreach work. And so that kind of leads me to where I am right now with Abt. And I'm excited to work with teams to use tech to make it easier for people to get the health services and the information they need to make healthier decisions. And kind of lucky for me too, like Emily and like Gabriel, our jobs really are to design and implement those digital strategies. So a lot of work in product design, development, and implementation. So that's a little bit about us. We're excited to work with you guys, and please feel free to reach out. A little bit more about Abt. Abt is an engine for social impact, and we like to think of ourselves as being fueled by caring, curiosity, and cutting-edge research. And for whatever the field that we're working in, that really moves folks from vulnerability to more security. And we've been around for, I think, over 50 years now, and we count on over 3,600 associates in over 60 countries. We work domestically here in the U.S. as well as internationally. And we cover, you'll see here, we cover a real broad range of intervention areas, ranging from health, that's really our stronghold, to food security and agriculture, governance, and gender, environment, energy, economic mobility. We really have an incredible kind of sense of, in our fingers on the pulse, both research-wise and also implementation-wise. And as Gabriel mentioned, we have a strong in-house team of data scientists and developers who support a lot of these programs and bring their ideas to life. And also, of course, we are a proud sponsor of Technica 2020. Next slide. Speaking of that, here is a quick plug for the Global Health Hack. You'll see those catalyzing questions here, and there are prizes to be won. There's a quick reminder, there's that $500 Amazon gift card for the first place team or person, and a $250 prize for the second place. winner. Next slide. So Emily and Gabriel are going to dive in and do 4 lightning talks on apps, different applications of global tech in, digital tech for global health. And as you'll get a sense, connect those to the questions that you're seeing before. And these were really created in response to real challenges that our teams faced. And we hope that these ideas will inspire you as well as you're working on those different hacks. So I'm going to turn that over to Emily for our first one.
Great, thank you. I'm going to be talking about three different initiatives, digital solutions that we've had in 3 different countries. Before I hand it off to Gabriel, so just sort of brace yourself for a bit of time spent with me. But the first one will be, we find ourselves in Nigeria, and this is a really, really cool, interesting project that we have. It is a mobile app called STARR, and it is an acronym. STARR is an acronym for Tuberculosis Screening and Tracking for Accelerated Referral and Reporting. And we developed this through our private sector health USAID project. And on the right, you can see our very sexy splash screen. So I'm excited to talk to you about this. Before I jump into the technology, and for all of my lightning talks, I want to talk about the global health problem first, because I think some people sort of see technology as, a hammer and everything's a nail. But I think it's really important to understand what is the context, what is the challenge, what are you trying to solve? And in this case, so I want to tell you a little bit about tuberculosis. So it's an infectious disease. It's caused by a bacteria, commonly spread through coughing. It can certainly be fatal, and Nigeria has one of the highest incidence rates of TB in the world. And one of the reasons it's so common in Nigeria is that clients might go undiagnosed. There's a lot of reasons somebody might be coughing, and they don't get enrolled in treatment because there is poor sort of detection at different types of facilities, and then they don't get referred. The cough is not reported, and then they don't get followed up with. And you can see sort of now with everybody's experience with COVID, contact tracing is really important. It's important to identify and treat people so that they don't spread it. So you can see here in the diagram, clients should walk into any type of facility, whether it's a medicine vendor, like a drug shop, a clinical facility like a hospital or a pharmacy or a lab, and then ideally they get moved to that clinical facility, and the national or state tuberculosis program is notified. But right now, everything is done in paper. That's in the right, you can see a picture of what it actually looks like to walk into sort of the registry administrative room in a clinical facility. So you can see it's really challenging to get fast results, to take quick action, to have the data that you need for decision making. So that was our big problem in Nigeria. And so they asked me to come in and work with the team. There's a large program team there. And our solution that we came up with about a year and a half ago was STARR. On the right, you can see is the interface. So essentially, it's an mobile Android application. The app is for clinical providers to use, so pharmacists, doctors, nurses, midwives. And they have a number of functionalities. So we've allowed them to screen clients. So there's sort of a decision-making tool and algorithm that we've included in there. They can take samples and send a sample to a lab if they're a clinic, and then the lab will send the sample back. So they'll get that data in real time. That's really helpful. They have some client record capability, and they can initiate treatment. So with all of this type of data, that gets funneled into our sort of web-based dashboard that you can see on the right. And so that's really intended for use by sort of program administrators, national health coordinators, so that all of this data that the providers are collecting in real time in the field can be funneled up and sort of aggregated and collected and then drill down on as needed so that they can actually take action. We are in the process right now of implementation. It's been a really exciting and very challenging project. So lots of learning to be done there. I just want to highlight a couple of technical and design considerations for this digital solution. So one big sort of consideration was, do we build an Android application, an iOS application, or do we develop a mobile website? And for a number of reasons, in Nigeria, an Android app really was the best option for us. Unlike in the US where, everybody's got an iPhone, it seems like Android is much more prevalent in developing countries. So that was the platform we chose. We also wanted to have very easy offline capabilities because a lot of the places in which we work don't have access to easy internet connectivity. So just something that we had to think about as we developed this tool. And we also hosted a user-centered design workshop, which is really one of my favorite parts. It's that really creative part. On the right, you can see sort of one of our flow diagrams. We brought together clinical providers of all different types and our program managers, and we were like, okay, what happens when a patient walks into this drug shop? What forms would you use? What questions would you ask? How can we digitize this process so that it makes sense? And you keep learning and learning, and you keep sort of drawing a diagram and then scratching everything out because you learn so much during that process. So that was really a really important design process, is designing with the users. We also, obviously, this collects patient level data. So that's really sensitive data, and security standards really vary greatly when dealing with US-based or international projects, but Abt tries to hold everything to the same very high standard. So STARR does encryption at 2 levels. One is the HTTPS, which ensures that data sent over the network is encrypted and only intended for specific servers. And we also encrypt that patient data before it even gets sent over the network. So it's really important to think about the level of data that you're collecting and using, and how to protect that data. Another sort of consideration we had was, do we use the cloud? Do we use a local server? So at Abt Associates, almost 90% of our projects are cloud-based. And we are a partner with Amazon Web Services, so we do use other services like Azure. And then the perks of the cloud are, lower cost, particularly for short-term projects, better reliability and maintenance, better accessibility if you have internet connection, and of course, unlimited storage and scalability. And for this project, obviously, we are looking to scale to all of Nigeria. Right now, we're in primarily 2 states with about 1,000 health workers. And what we want to go is really to scale. So we needed something that could really support that. And then, sort of thinking about our backend database, do we use a structured or relational database or unstructured? And this is kind of a trade-off. A lot of international firms use unstructured because it provides a lot of flexibility. You can add data elements and fields as things change, so it's very flexible. But one thing we've noted is that it makes it harder for sort of our program team to pull queries because it's not as intuitive on the back end. So that is STARR, and I know that's a lot to throw at you, but I'm going to throw at you another case study called HelloJubi. You can see it's HelloJubi.in. So it's our reproductive and sexual health chatbot for youth in India, and you are welcome to check that out. If you're curious about condoms or anything, feel free to sign up for that. It is intended for Indian youth, but I think you guys could, check it out, see what we've got to say. And basically our global health problem here was that, India has a huge youth population, but really poor access to credible and sort of youth-friendly or youth-tailored information on safe sexual practices, contraception, family planning. Search engines don't really return, the right information. And because of this, there's a ton of misinformation about family planning and contraception. So, youth who might be sexually active really don't get the information that they need in a tailored way. So that was our challenge, and our solution in India was, we started really with a whole social media ecosystem using Facebook, WhatsApp, Instagram to spread and reinforce our messaging around safe sexual practices. But then our Facebook page links to our HelloJubi chatbot. So basically it just answers common questions. It ensures privacy. It has quizzes, so it really sort of gamifies some of this process. It uses sort of colloquial language to make youth feel sort of at home, and bright colors. Jubi is actually the unicorn, the magical unicorn that answers these questions. So that was one of our digital solutions that's been fairly well received. And so just some of the technical and design considerations. So HelloJubi uses a built ensemble Python NLP model. So it's a combination of different models. And it uses multiple algorithms to process these user queries, and then sort of a voting algorithm to give that the output or the response. And this works actually really well with our multilingual chatbots like HelloJubi. It's made on a builder platform, which actually means for those of you who are beginner coders that you don't really need coding experience. We do have a developer for some of those more advanced features. And then our tech backend for the bot is built on Node.js, which is very fast. We don't want people sort of having a slow conversation. You ask a question, you have to wait a minute to get an answer. We also engaged in user-centered design for this process, how to workshop, tried to understand what types of questions people might answer and what type of responses they might be looking for, how they ask those questions, sort of what are the more taboo questions. So that was, I wasn't a part of that process, but that's always part of our process at Abt, is really understanding how the user will engage with our digital solution. So as I mentioned, HelloJubi is available in Hindi and English. So it has actually two separate chatbots in different languages. And we really needed to make sure that this localization process was completed by making sure that the language was right, the cultural sort of nuance was there. So that was a big part of our process that really came out of part of that workshop. And then lastly, encryption and security protocols. So, these are potentially vulnerable youth accessing the tool. And so we use end-to-end standard AES encryption for any kind of data transfer. So that's HelloJubi, and it's a really cool chatbot solution it's tailored to a specific population. And yeah, definitely a really interesting digital solution that we've used. My third sort of lightning talk takes us to Nepal, where we have developed a quality assurance mobile application for quality assurance officers who support family planning outlets. So drug shops, pharmacies, and clinical facilities that offer contraception and other family reproductive health services. And you can see the sort of main interface of the QAM app on the right. So here the challenge was, the quality of family planning counseling service and products really do affect client uptake and satisfaction. So if a facility is giving bad advice, is making people feel alienated, is as a stock out, that can really prevent somebody from asking questions, returning for follow-up visits. And so that's a real challenge. And our partner, CRS, provides training and promotional support to over 3,500 clinics and drug shops and pharmacies. And until 2018, as in Nigeria, all that documentation is done by hand on paper by quality assurance officers. So you can imagine it was really slow in taking corrective action, in making sure that clinical providers are providing the level of care that you'd want in, a facility affiliated with your brand. So our solution here, and actually we've done a number of different digital solutions with this group, but I'm just going to highlight the QAM app. And it is used for really a number of activities. Again, it's used by their quality assurance officers. So they can do a technical support visit, so document everything that happens during their visit. They can use different, radio dial buttons and, check different boxes to try to make it as intuitive as possible. They can also provide feedback to the manager, so that's all done in real time. They can facilitate quizzes for those providers. They can schedule tasks. They can offer reference material, so all that's downloaded onto the phone. And so it's a useful sort of textbook that fits in your pocket. They can schedule their meetings. They can coordinate their outlets, so the outlets that are assigned to them. They can sync it. So obviously it has an offline capacity. That was really important. So it's important that you were able to say, okay, I'm now back in internet connectivity, so I'm going to sync that back. So it was just a really useful and pretty straightforward tool. Sometimes it's not super groundbreaking, but it's really just digitizing the work. And so some of those technical considerations, some I've already touched on, but, we used again, it was an Android platform. There were complex forms. Again, Android is super prevalent in Nepal. We wanted the offline capacity. So that's what we did. And then we also, the programming languages for that were just Java and Android native development kit. And let's see, for the user-centered design workshop, as I say, we always run these. It's really important to understand the flow of information so that we don't complicate or duplicate people's work. That's something important to keep in mind. And then, so the QAM app is actually, has the lowest risk in terms of data because we're just capturing information about a facility, not about a patient or a specific individual. So that's really helpful. So we chose, actually, unlike the other two apps, we chose a cloud-based server, a local server here. And one of the reasons for that was the company already had a local server, so that was easy. We weren't planning to scale this in a, hundreds of thousands of people kind of way. We only expect maybe, 100 people to be using it. And another consideration is that sometimes country governments really want the data to remain within the physical confines of the country. And so that's important consideration when doing international development. And then finally, we used a structured database because with a sort of MySQL backend, and we wanted it to be really user-friendly so that the company could pull those queries, have that row column format. And so those are three very fast, very lightning-y talks about some of our digital solutions in development, and I'll be happy to answer questions about them after my colleague Gabriel presents.
Awesome. Well, thank you very much, Emily. That was a lot, but it was very good. I think, the fascinating thing between all of these examples that we're talking about is you can see sort of some of the, how some of the different choices are made, both from a, what problem we're trying to solve to, okay, then how do we, attack that problem? What are the technologies that we use to address that? And then what are the approaches that we use to even think about how to address that? So so thanks everyone. Great to be here. Like I said, so I'm just going to be talking about this one example, MEC vision, mosquito egg computer vision. And so I'm kind of going to split it up here in the little time I have into two parts. And so I just want to spend the first part talking a little bit about the broad sort of use case, the environment, this challenge that we're trying to solve. And then second part, I'll dive a little bit into, the technology and sort of why we made some of those decisions around what technology stack we were using and, just sort of the thought process on that. Go ahead and go to the next slide and I'll just leave it here as I talk through it. So one of the things, so let's talk about the use case first. So from the name, you might know that this might involve mosquitoes and vision. So we might involve looking at them. So backing up just a little bit, we at Abt Associates have had a contract with the U.S. government, so the U.S. Agency for International Development, to look at and address the problem of Zika in Latin America. And so how to think about how can we sort of understand the disease better? How can we understand the carriers, the vectors of the disease better? And this is really in line with a lot of the work that Abt Associates does around global health, specifically around sort of communicable diseases like Zika, but also along with, we do a lot of work around malaria and yellow fever and chikungunya and all sorts of other diseases, particularly ones that have mosquitoes as a vector. So mosquitoes are the ones that, they bite you, they get some of their blood, some of your blood in their system, then they go bite someone else and transmit it that way. And, malaria alone kills millions of people every year. And Zika, you don't hear about it as much in the news right now. It's still there. Just there's so much else going on in the world too. So it kind of gets crowded out a little, unfortunately. But this is an area where we've worked a little bit to be able to really understand how this disease spreads. And so in understanding and trying to understand how the disease spreads, we really want to understand the mosquitoes themselves, what they're doing, how they're traveling, how best we can, either eradicate or sort of stem the tide. I mean, much like how we're thinking about COVID right now, where are the hotspots happening and how can we sort of stem the flow of those hotspots? How can we cut off that sort of supply chain for the disease itself? So going a little bit deeper into that, in understanding the mosquitoes, one of the ways that we do that is we basically sort of have a surveillance program of trying to understand the populations. Well, they're not big things. We can't attach sensors to these mosquitoes, so we have to use other methods. One of those methods involves essentially setting out traps where they're just like little cups filled halfway with water. The mosquitoes, they lay their eggs in this water, and the eggs kind of float to the top. They stick to the surface. And then eventually they sort of stick to these traps that we have. It's just basically paper towels, as you can see in image number 3. After about a week, there's enough eggs in there that towel gets collected, it gets dried, and then it gets examined by hand. So you can see this process in images 1, 2, and 5 if you're looking. Number 4 there on the lower left is the collection of these papers. And what they do is they basically go through and they count the eggs by hand. Now you can sort of see them with the naked eye. So you can see in image 2, he's using a magnifying glass there to see him. It basically looks like if you were to like have a pepper dispenser, and you sort of put it over a napkin. You can count it, but it's really tedious. It can take hours to count just a handful of these sheets. But by doing that, by understanding how many eggs are being laid, what types of species are in this area, all sorts of things, you get a better understanding of what the environment is for the mosquitoes in these areas, what's working, what isn't, and then you can understand better how to address it. So, as you might imagine, there's a real interesting problem here that this takes a long time to count these things by hand. It's pretty tedious work. It's very manual. This is a perfect environment for an automated process to come in and take this over, to basically say, wait, we can just shine a camera on this thing, put a camera on this thing, and count this automatically. And the amazing thing is we kind of knew that there's technology around nowadays that allows us to do this. So go ahead and go to the next slide. I can talk about it through this. So that's kind of where we're at. Now, let me just sort of remind us of a few things on the use case side. And they're really similar to Emily's issues that she brought up. We're thinking about, well, wait, who's going to have a smartphone? How powerful does it need to be? What kind of technology can we use on it? Is it going to need, access to a centralized server somewhere, some sort of cloud technology to be able to process the image and then get back a number? Or is this something that we really have to be doing all locally on the device itself? And in addition, what is the user interface going to look like? What languages is this going to be available in? Are we going to be storing this data, or do we just need the number itself? So all sorts of design challenges, from thinking about how best to use this thing in the field, in the actual use, and then how do we design around that? And so you'll see some of the decisions we've made here around, the user interface and how it works. And then, sort of putting all those pieces together to try and come up with a product that we released as an open source piece of software. And a version of it, the sort of version that we did for this program, is now owned by USAID, the U.S. Agency for International Development, and they can, so it's public domain code. You can also find it on Abt Associates on our GitHub page too. So it's completely available. I'm trying to think if I want to touch on anything in this particular slide. I guess the one thing to note here is, while we did build this in-house at Abt Associates, all of the technology stacks that we're using are open source libraries, and frameworks and systems. So, we're really not putting in a ton of proprietary work that's licensed exclusively to Abt Associates or anything like that. And that's one thing that might differentiate this from some other projects and other companies that are doing this type of work, that all of this is essentially out in the open. And so we're using Vue.js as a JavaScript framework. We're using, this is essentially a progressive web app. And so using, JavaScript service workers to make this available locally on any device, whether it's any smartphone device, I should say, whether it's an Android device or an iOS device or a laptop that you might have in the field, or a desktop computer. All of these will work with this. So that was one thing that was critical for us. And the rest of it, the computer vision component is really just made out of using OpenCV. If you've heard of that library, it's a pretty common library for doing image recognition, image detection, object detection within image recognition. There's a JavaScript version of that that you can actually sort of load entirely locally. It's about 5 megabytes. So we're using that and kind of calling that, and that's essentially it. It's pretty simple. It's not perfect, but it does in fact work very quickly, and it works at about the same accuracy level as a human counter does. So that was fantastic, and that was obviously one of our requirements going into it, so that it really just saves the technicians a bunch of time. I will just say finally on that point that, one of the things we were thinking about early on in this process is like, we're not going to take away anyone's like actual jobs or livelihoods from this project. And thankfully there was like a resounding absolutely not. This is a part of the technician's job that really they don't even like doing. It's pretty tedious. And by freeing up this time, it allows them to spend more time doing some of that really important and difficult field work of setting the traps, of collecting them, and so on. So that was a really important piece of us as we went through, just thinking about the areas where Abt Associates works. And then maybe to hit the next slide, and I'll just leave this here as the last point. And I'll just say, sort of, for all of you folks that are developing apps yourselves, one of the important things is that, like, this is not rocket science for us. We really just started thinking about, okay, let's use pen and paper and sketch out what this thing needs to do. There's no official like process that you can go through. There's definitely helpful guides out there and helpful ways to think about, oh, do you want to use Figma or something to sketch out what the interactivity is going to be and how it needs to work? But really, it started from what is the problem we're trying to solve? What are the important things we need to think about and the priorities? And then how do we get there? And then how do we think about wrapping that technology solution around that challenge? And that's really the key thing that makes or breaks these technology projects and these hacks. So that's kind of where we're at, and would love to answer any further questions that you all have, or ideas and thoughts about that particular one or others. Thanks.
Great. Thanks, Emily and Gabriel. And those are really great overviews. And I think just with all of them, I hope that you all can see just how apps teams were, as Gabriel was saying, just like facing different challenges. And a lot of them are revolving around how do we get more effective? How do we get more efficient? How do we use tech for good and to really streamline things? Whether it's making it easier to deliver TB care and streamlining literally tons of paperwork that are in clinics, or making it easier to get information about sexual and reproductive health, or becoming more effective at understanding how mosquito-borne illnesses spread. Oh yeah, thanks. And I think that connects really nicely back to our catalyzing questions, because literally these are things that we're thinking about just about every day. And ultimately, like, our teams are designing really different kinds of digital solutions that help us to become more impactful and effective. And one of the things that I think is important to underscore too is that these, like, all of these different solutions, they're really built with a broad group of folks, both in country, especially just driving the like that framing question and the challenge, and also just the in-country developers when possible, and also our headquarters design teams. There are data scientists and developers that also chip in. So one of the things that I hope is also coming out is that it's really a team effort to design and deliver these. We're going to shift gears a little bit and move now into the question and answers. And first of all, we've gotten some good ones in the chat, and please keep them coming. The first one is, how do we decide where we work? And I'll actually dive in on that one. That's a really good question. And different organizations work a little bit differently. And we, as Abt, we typically respond to donor requests for proposals, and often they'll specify where we need to work. So that's usually based on need. So for example, I work on a maternal and child health program in Tajikistan, where we work in Katlan province because child nutrition and maternal mortality is especially low in that province. So that's a need. And then I work on another project in Mozambique where for HIV testing and treatment, and we work in 4 provinces out of Mozambique's 11 provinces because there's organizations covering the other areas and we don't want to overlap. So I think like one of the really important things in international development is making sure that we're careful not to overlap. We're building on the good work of other folks, and we have close coordination, whether it's where we're physically working and also digitally. And that's also a plug for the principles of digital development too. And I'm sure that we'll chat about those later in our answers. But as for Abt, we have a footprint in 60 countries. In some of those countries, for example, we've been working for over 30 years, like Zambia and Ethiopia. That doesn't mean that we work in the entire country per se. We might work in targeted regions, and that might change from project to project. So that's how we work, and that's how we decide how we work. And then actually another one, here's a great question about sustainability and handover. Lydia was asking, how do we approach long-term maintenance of projects once they're shipped or once they're completed? And do our teams maintain and update these apps indefinitely, or do we hand them off to someone else? And actually, Emily and Gabriel, I think that really ties in nicely to your presentations. Do you guys want to tackle that and how each of them were a little bit different and similar?
Yeah, I'll take the lead. One challenge we have is, we are donor funded, and oftentimes our projects are a 5-year project. And then at the end, we sort of hand off the tools and technologies, and we have to sort of leave that space. So what we try to do is use, open source tools that are adaptable and adoptable by local stakeholders. We try to build their capacity during that time so that they can take over, the implementation and the utilization of these tools. So for example, in Nigeria, our project actually ends next year. And so we're working really hard to find a home for TB STARR with the National TB Program. And then, making sure there's somebody who can sort of sponsor some of those changes that are needed. So yeah, definitely an important consideration and something you should think about at the outset and not sort of as you're closing up, because it will be too late. So.
Yeah, I would agree with that 100%. And it's one of the big problems. I mean, this is not just, endemic to the area that we work in here, but in software development in general, right? These things decay, they've got a half-life. And so often, we really have to think explicitly around, how is this going to last? Are we sure that we're not just using the latest and greatest tool that's sort of a flash in the pan, but is that going to be something that's going to be supported in 5 years, 10 years, 15 years? So sometimes we have to make really hard decisions around those trade-offs to kind of invest in like a boring, frankly, technology that might not be as flashy, but will be something that will, has the potential to last, and critically is something that other teams can learn on, improve on. That's another thing that we have to think about too, that handoff piece. not just for folks that we know that are working on the project, but for folks that can come along later? Are we doing everything that we can to be using open standards, to be using sort of the systems that will be sort of recognizable and accessible and universal in the future, even a future that we don't know the next folks that are going to be working on a particular project? It's a really good question and a really interesting issue.
Yeah, absolutely. And one of the things too is because we work a lot with big governments, and a lot of times too when we're building these solutions, we think about how are we also co-designing these or implementing them with the government so that they're able to absorb this and they already have that capacity, and we are not scrambling at the last year of the project to hand this over. It's really kind of part and parcel, and they're comfortable with the solution. And also to Gabriel's point too, and to Emily's, just we're doing careful consideration about which technology we're using. So a lot of times that does steer us into an open source solutions, sometimes not, but a lot of times it is easier just to be able to train our government counterparts on that. And I see that Emily also is giving a plug for our messages, just if you want to learn more about that. All of us are available, or come over to our booth and learn more. We're going to, I don't think that we have any more questions from the audience, so we will transition to some of the others. And we're getting more into the design. I think that was also coming up as a common thread in your presentations, and we saw all kinds of different programs represented, from family planning to preventing mosquito-borne illnesses, and each of them had different challenges that led to digital solutions. And I was wondering if you guys can share a little bit about what usually leads teams to use digital tools versus opting for perhaps the status quo. And if you can describe a little bit about the process of how the teams conceptualized the solution and what design principles you used. Emily, how about you?
Yeah, that's a great question, great big question. And yeah, so I think we have to really find a balance of, when is digital technology appropriate to apply, and who will it benefit, and what is the sustainability potential for that activity. I think oftentimes, we see that there's this huge boom in mobile penetration, that, people have more phones and more connectivity. It's great. You have to make sure, there's this thing called the digital divide, where this boom is more exponential among higher income and more empowered populations. And so you want to make sure that you're not missing out on sort of that most vulnerable low income population, because you're creating a tool that is only really designed for, for the benefit of those higher SES populations. And I think that as we transition, sometimes we need to do sort of a dual method, right? So we know that we want to move towards digital. We know that this has potential for efficiency, but at the same time, in order to not drop out those people that can't, benefit from that, we do sort of a dual, paper-based tool. And so, we really just think about what is the context, what is the right tool for the right job, and how can we implement in a sustainable, rational way. So
that was a good answer. I don't know that I have a separate one. It's good. Oh, you're on mute, Sarah.
Technology. Thanks, Gabriel. So I think we're out of time, unfortunately, but all of us are available just to answer more questions. This is obviously something that we're really passionate about, and we're so excited to see that all of you joined us, and also just we're keen to hear your questions about this. You have our email addresses, and the technical platform is great to connect. So thank you, everyone, and I hope you enjoyed the rest of the hackathon. Thanks, everyone.
Thank you.
Thanks. Bye.